Nick Adkins at NickRealDX, Health Innovation Media, on the ground at ATA 2015 with Dr. Sunny Malhotra from AdvantageCare Physicians. Sunny, good morning.
Good morning.
How are you doing?
Great.
How are you enjoying the conference?
It's fantastic. There's a lot of advancements in telemedicine, a lot of advancements in personalized healthcare, and that's one of the biggest themes that I've seen in ATA 2015. Absolutely.
Awesome. So you're a cardiologist, and so tell me from the physician's perspective on the ground here, what are you seeing, what are you feeling? Tell me the sense of what you see for the future.
I think the theme of this year is personalized medicine for sure. And what we're seeing is the three pillars of personalized healthcare. One being care that is anywhere. The second one being care, networking and building networks around the patient. And then the third one is definitely care customizations for our patients. And as cardiologists, this is very important because now we're seeing a dynamic where you're changing where the patients are being taken care of. And so you're taking it from the traditional model of in a hospital, in a clinic, and you're bringing it to a home setting. And that's where a lot of patients want to be taken care of first. And that leads to earlier detection, reduced readmissions in some circumstances. And that's what we want as a physician group.
Tell me about AdvantageCare Physicians. What's the story there?
So AdvantageCare Physicians is a large company right now, and we're basically a model where we take care of patients on an outpatient basis. There are 300 providers. There are over 30 practices around New York, and we take care of about 450,000 patients under the AmWell Health insurance model, as well as other insurance carriers.
That's awesome. And how old of a company is this?
We've been around for about 2 years, and we've been growing very fast, and we've been trying to deliver the best care possible and innovate with telemedicine and a lot of the advancements that we're seeing in this area. 2
years. How did you grow so fast?
Well,
besides you're awesome.
I think the model is you got to deliver good care, and you got to make sure that the people are happy with the care that they're getting. If you can't provide that pillar of the personalized healthcare model and there's no customer satisfaction, then you're not going to grow that way. And that's what AdvantageCare Physicians is all about.
And do you have your own telemedicine platform, or are you partnering with a telehealth provider? What are you doing?
Well, right now, this is an avenue that we're starting to get into, right? We're looking into these areas and which telehealth medicine provider would be best suited for our company. It's a little bit early to discuss kind of where telemedicine is going with AdvantageCare Physicians specifically, but it is definitely something that we're looking into. And they have been very supportive sending me here to the ATA 2015, and I'm very grateful.
Are you shopping?
I am shopping a little bit, and I'm seeing what the advancements are, so very happy to see it.
Can you mention who you like? Maybe the top 2 or 3 that on the short list?
So, the first pillar that I had mentioned, the telemedicine, I think everybody has down, right? How to provide the telemedicine so that you can get care anywhere. The second component, the care networking that we're doing, building networks around the patient, the infrastructure is coming so that it's built around a patient's home. Lab diagnostics, vital sign monitoring, they're becoming wireless, they're becoming cloud-based, and we're starting to look into that as a way to implement that in our clinics. And then the third one that, to me is beyond the telemedicine 2.0 is care customization. And what we're seeing is bringing all that data in, analyzing it, and then providing actionable data to the physician so that things are picked up earlier, you have less costly readmissions, and you have less readmissions. And so one of the companies that I've seen just yesterday was Sentrian. And Sentrian, if they're FDA cleared, definitely deserves to win this Innovator Award, because they're thinking about the next stage, right? So they get that data, they have an algorithm, they have a machine learning process, and then afterwards they bundle that and they present it to a doctor with their recommendations. And once you do that, everything changes. Those analytics, that artificial intelligence, that machine learning, that's where we're headed. And that's much beyond what we've seen already in the ATA 2015. They're well beyond where a lot of the companies I've seen here today have been.
Where do you think IBM Watson fits in with that?
They have a chief data scientist from IBM Watson. He's been working there for 8 years. He's a fantastic guy. And I definitely think he brought some of IBM Watson with him to Sentrian, and I think they definitely have really changed the game, and they are way ahead of their time right now.
Yeah, the word on the street from IBM Watson, from James Wolpert, is Watson is IBM's go-to for the next 50 years. I mean, IBM is all in on Watson.
I understand why. I mean, they are providing and consuming so much data and presenting it to us in such an innovative way. And they're out in New York as well, and we've seen, and they have another office in Boston. They're coming up with great stuff, very innovative, and there's only so much data that we can consume as physicians, right, at any point in time. And they provide you with a lot of data, and they bring it all together, and then they present it to the doctor in a very simple way. And we're going to start to see that a little bit more down the road, but IBM Watson is definitely one of the strong points, that, the big data consumption and providing a platform for us to use to make medical decisions as physicians.
So Sunny, from a physician standpoint, tell me of the telemedicine companies you've seen here at ATA 2015, what are the ones that stand out? What are the ones that maybe you want to shy away from? What are the things that have excited you? What are the things that have kind of repelled you? You tell me.
So I think that people are not only going from a niche telemedicine standpoint. We see One Doc Way with their psychiatry platform and focusing on child health and those specific areas that really require a lot of physicians to become incorporated in to serve a very underserved population across the country. And then you see other providers like MDLIVE that I've seen have been doing great things, AmWell doing great things, and what they're doing is really they're providing not only a platform for telemedicine to be provided for a direct-to-consumer standpoint, but they're also providing and they're integrating into the homes, right? So they're using HealthKit now from Apple. And so that's what we're going to start seeing. They're going to use those platforms to help provide more data to the physicians and then and make decisions based on that data. And so that's where things have been going with the telemedicine larger providers, and there's the big four, and then there's the niche players over here. And the niche players are definitely focusing on their areas, and they are very vital to the whole picture. But the larger players, the big four, they're also providing a certain role as well, and they're trying to become integrated into this system. For example, MDLIVE, they're integrating with Microsoft, they're integrating with Walgreens, and they're providing different touch points for the physicians as well as the patients so that they get care in multiple different locations, and again, care anywhere.
Right, I think the MDLIVE connection with Walgreens is going to be huge. I mean, the ecosystem that Walgreens has built around their mobile health app, I mean, 1 in 3 Americans have the Walgreens app on their phone. It's just, it's a no-brainer.
Absolutely. Again, creating networks around these patients, bringing it home. That's what I'm starting to see here in ATA 2015. And it makes sense, right? Because healthcare is not just delivered in one location. And with the ACO model coming out and the way reimbursements are changing now, we have to think of innovative ways to take care of our patients.